There's been a lot of concerns over the latest round of meningitis outbreak in Nigeria, which has so far been recorded in 19 states as at April 5th, 2000. Despite the sad loss of over 400 lives to the disease, mostly in 5 northeast and north-central states of the Federation, there appears to be little knowledge about the disease within the populace.
Around our meningitis is kind of sickness caused by heat. So that is what I know much about meningitis.
What do you know about meningitis?
I don't know much about it.
Meningitis, is it the one that is worrying women?
I don't know. I've not heard about the brain.
It's all about an upsurge of ailment as a result of improper ventilation.
Clearly, there is need for more public enlightenment on meningitis, which is a disease caused most of the time by viruses or bacteria found in the intestines or in the nose and throat, leading to an inflammation of the membranes surrounding the brain and spinal cord.
About 10 to 20% of the population carry this bacteria, Neisseria meningitis, in our population, and then they are carriers, and it doesn't affect them. But in dry season, and because of cold nights, the dry winds, dust, and then frequent respiratory tract infection, so you have this breakdown of this mucosa lining our respiratory tract, because this is actually carried in our throat. I mean, those who carry it. So because of this breakdown, then it may now go into their system, right? And then be spread by blood, and then now get to the brain. That's when it starts causing problems.
According to health authorities, this current outbreak in the country is based on an unusual type of microorganism.
The strain of meningitis this year is a different type. We used to have meningitis A, which has been virtually eliminated through mass inoculation. But this time we have meningitis type C, serotype C, which has never been common here before. And it has sort of like ambushed us. And these vaccines against it are not so common around the world, but they have been mobilized and they are already being applied.
Reactive vaccination campaign has begun in Zamfara State, where this present outbreak was first recorded. However, it's important that everyone knows its mode of transmission.
Meningitis is spread by droplet infection. People cough and sneeze around you. So in crowded environment, like inside a very closely packed bus, in dormitories, in barracks and so on, you have a risk of infection. So we urge people to live to have their rooms properly ventilated, to avoid very close contact, especially in areas where there's an outbreak, and to make sure they wash their hands properly, eat well, and take care of their own personal and domestic hygiene.
The essential prevention against this is the vaccination. Even the healthcare workers who are taking care of these patients who are also prone, that's why they all have to be vaccinated. And they also need to ensure infection prevention and control practices. Wash their hands, use their face mask, do anything they need to do to minimize the risk of this transmission. And then people are also to report cases, because case management is the key way to manage these cases, because those who have it, if you leave them in the community, they continue to spread it. But if you bring them here and then you quickly treat them, then you reduce the chances of spreading it further in the community.
Spread the knowledge and not the disease. Report any suspected case of meningitis to the nearest health facility. Yomi Otaibo reporting for Channels Television News.